I went to school different places, and so starting off I was in Kansas City, Missouri, really a little town called Raytown, and the Blue Jays were Raytown Blue Jays, and it's also a city where Mama's Family was filmed, so that's our claim to fame. And I used to work at Royals down the street during the good old days with Bo Jackson and Brett Saberhagen, and that was a fun summer for me throughout high school. After high school, I went to Baylor, so I came to Texas, and Baylor Bears are still where my loyalties lie. After college, I then went to Yale for medical school, which is 4 years, and residency, which is 5 years. And after Yale, they're the Bulldogs, I went to Mayo Clinic in Scottsdale for a foot and ankle fellowship for a year, and I don't think they have a mascot, but I enjoy, after work, going home to be with my family. That's my second job, kind of, but it's a fun one too. We, at this point anyway, have done more outdoor stuff, like going to the preserves around Dallas. I just moved here a year ago, and prior to that I was in Corpus Christi, so there were different things we enjoyed to do there, but still like to bird, and the birding here is different than the southern Texas area, but we go swimming and trying to teach my son how to bike with no training wheels. We're down to one training wheel. We're going to make it this year, but it's just fun to be with them, and they've been on the swim team, so just more doing activities with them. And my husband of 15 years, who I am very grateful for. I usually get up earlier than the rest of the household, so I can have a quiet time to center and focus on that day and the activities of that day. One of St. Benedict's prayers that is meaningful to me is when you wake up from sleep, we should rise for the joy of the true work that we are about that day and considerately cheer one another on. Life will always provide matters for concern, yet every day there are reasons for joy. And the joy of getting up and going to a job I love is very compelling, and being able to meet new people each day, understand a little bit about their stories, and then to the challenge of trying to diagnose different foot and ankle problems and collaboratively work towards a treatment plan that works for each individual is important to me. Sometimes that treatment plan is conservative treatment, whether it's changing the shoes or different orthotics, to diet, exercise, supplements that also can be incorporated. There are other modalities, acupuncture, some forms of laser treatment, cryotherapy, platelets, injections and stem cells can all be part of a treatment plan that isn't surgical. But then there are also problems that need a surgical fix, and that's also part of the reason I think a lot of us go into orthopedics, is that it's a hopeful practice. We get to fix something and get that person better again often. And surgery is very scary for a lot of people, and as a team, I think we all try to make sure we're there for each patient before, during, and after the treatment. There's nothing more rewarding and humbling as to have a patient who comes through the doors in a wheelchair or on crutches, and after appropriate treatment walks out on their own 2 feet towards healing and wholeness. And that's a big reason why I think we all get up in the morning, is for that.